So with positioning, we're aiming to get your patients into an optimal position for the respiratory muscles. Your patients with COPD won't have that nice dome diaphragm that you have. Okay, it'll be a lot flatter. So what we're trying to do is to maximise that dome position and to allow the respiratory muscles to work as efficiently as possible without increasing the oxygen consumption they get when they actively fix their upper shoulder girdle. High side lying is a position that we can get our patients into in the acute setting. We can either use a lot of pillows to get them into a good position, or we're lucky to be able to use the back of the bed. This position helps improve the length tension relationship of the diaphragm. It also helps reduce the resistance on the respiratory muscles by offsetting the diaphragm. So the diaphragm, the abdominal contents move out the way. This makes it easier for your patients to breathe. You can ask your patients to lean forward. So they can lean forward onto their forearms, onto a table, and that can be with or without pillows. So if they're at home, it may be that just getting them to lean onto their forearms is enough. It could be just from a comfort perspective that they would prefer some pillows. Again, this is one that can be done in the acute setting, and it's also one that you may teach your patients to do when they're at home. Another one in sitting you can do is to just ask your patient to sit in a nice relaxed position, relaxing their shoulders and placing their palms on their lap. I would always ask my patients to turn their hands up as it's harder to fix the shoulder when the palms are facing up. Positioning is important when out and about as well. This means your patient can get into an effective position to help them to recover from incidents of breathlessness. When they're out shopping, we would always suggest that your patient would want to use a trolley anyway. However, the trolley also allows them to take breaks and to get into a good position, so that they can lean on that trolley. We'd also give them some positional advice for if they're just out and about. Again, that can be leaning forward, so on anything that's in front of them, so that be that a wall or the bonnet of a car. However, we may also get them to lean back against things. Okay, so they may lean back against a bus stop, a wall, a shop window. In these positions, they can be combined with other techniques such as breathing control. Positioning in itself is going to decrease the load, but there is probably going to need to be another step in there in order to get them to be back in control of their breathing. Patients can remain in these positions for as long as they need to. So that may be until they feel that they are back in control of their breathing, or that they have recovered enough to continue with whatever task that they were doing.
This picture shows all the positions that you may use with your patients. It's taken from the REST-B modules by NHS Scotland. The pictures are taken by Wendy White.